Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Network Strategist for the Division of Public Health and Community Services. And today I'm joined by our Director of the Division, Bobbie Bagley. Welcome, Bobbie.
Jane, it's so good to be here with you this afternoon.
Well, I appreciate you coming back. We have a lot of things to discuss today because Public Health Week is coming up. And that's such an exciting time for us, and it's so nice for us to be focusing on something a little different. But before we get to something a little different, we are going to do a little COVID update. We talked a little bit before the show. You know, people are tired of this. We get a little tired of it, but it's not done, and we haven't turned the switch off on the wall, and so we have to still talk about it. We still have to be mindful that there is a virus out there, and we do have to take precautions in certain situations. So this is our second filming where we're not wearing our masks. Very exciting.
Very exciting. We're making some good progress.
Yeah, so we are making some progress, and the numbers have dropped really in the last few weeks since we were on last, and also you know, a slight uptick, which we'll talk about. Not sure what's going to happen with that. But we'll just review the numbers really briefly. And I did want to explain to our audience about community levels because the CDC has come out with this, and they're kind of rating each county, really. It's county by county across the whole United States on how you rate. So it's very easy to understand. Green light, go, low. Medium is yellow, and high is red. And so if your county is one yellow or red, it's time to really put your thinking cap on and take some precautions. So when we talk about green, which is happily where we are now in Hillsborough County, it's stay up to date with your COVID vaccines. So that means if you've already had your series, have your booster, and get tested if you have symptoms, because we do know that the vaccine can prevent us from severe illness and hospitalization, but can't necessarily keep us from getting COVID.
Right.
So we know that we're much more protected than we were, but we still have some. We still have to take some precautions. So that's green, and yellow is if you're at high risk for severe illness. We want you to talk to your healthcare provider about whether you need to wear a mask or take precautions. Again, stay up to date with those vaccines and get tested if you have symptoms. And then if you're in the red, you want to wear that mask.
Right.
Out and about, inside, outside, and the usual. So we're going to look at the community map from 2 weeks ago first, and you can see on this one, there's quite a bit of green, which was exciting, and a few patches of yellow and red kind of all over. And then if we switch to this week, we see that almost the whole country, 90% in fact, is green.
Yes.
And we have a few regions in New Hampshire and the upper, in the North Country that are trending yellow right now. So we do want people to keep their eyes on that. It's very easy to go on this tool, put in CDC community levels, type in your state, New Hampshire, unless we have some Massachusetts viewers, but I don't think we do. And then also you put in your county, or if you're traveling north, you put in the county that you're visiting, just to get an idea of what kind of precautions you should take. And I think that's really important. We don't want to take our eye off the ball. So in New Hampshire, we have currently we've had 301,687 cases. That's up about 1,600 from 2 weeks ago. So not the huge increase that we have been living through, holding steady. And we have 1,070 active cases. Our test positivity is 3.6%. And yesterday was reported 143 new cases. So that is up a little bit.
Yes.
So there's just the positivity rate is up, the number of cases is up a little bit, and we're not really sure what that might be due to. We think it could be the Omicron variant, which is, I always say it wrong, B2A. You can tell me.
Yeah, beta 2.
Yeah.
So Omicron beta 2. And I mean, the thing because we still have virus circulating, even though we're all at low pretty much across in New Hampshire with most of our counties, when you still have just a little bit of circulating virus, anybody can still pick it up, which still does make it transmissible to any of us. The thing, again, that we want to encourage is vaccine, because that will prevent folks from having more severe illness that could lead to hospitalization. And then you got to think about it. I mean, we're in the college break time. So, you've also still have traveling. And as you look across the country and it's green and people have taken off their masks, if there's circulating virus, folks can still get infected. And so when people start to have signs and symptoms, I'm glad that people are still going to get tested. So we still want to encourage that if people develop certain signs and symptoms, go ahead and get tested so you can rule it out, so then you know what precautions you need to take around other individuals. So we're going to see these ebbs and flows, a little bit of ups and then hopefully going back down. But I expect that we should see that until probably we're going to be moving more outdoors because the weather's getting warmer. So we can get our windows wide open. Windows open, yes. And so we'll see some of that continue to ebb and flow up and down. But we're still looking really good in the U.S.
Yeah, which is really kind of a relief. I was going to say exciting, but I don't get too excited anymore. I feel a little bit of relief.
We'll be where we are for right now.
Yeah, exactly. We're holding steady.
Right.
And so we have only 24 hospitalizations right now. Checked this morning, only one of our hospitals has COVID patients right now. The other one doesn't have any, so that was really great news. And we've had 2,445 deaths. So hopefully that will slow down and stop with these fewer hospitalizations. You did mention vaccination. I have a little slide. It's not too late to vaccinate, folks.
Not too late. And in fact, we definitely encourage it.
Yeah, we love rhymes, but it's just true, And I looked at these numbers again when I get prepared for days like today. I'm always looking at what did we do 2 weeks ago, because we film every few weeks, and it's really a good thing for me to see, because I can see if the numbers are going up or going down, and it's a nice amount of time so that you can actually see a good trend. And we are having more vaccine. We have 59.8% fully vaccinated in the state. That's up about 2%. I think some of that is due to the states being to bring on some of the pharmacy data online, and that continues. They're continuing to solve that problem. So some of this might be a little bit low in our numbers, but I think it is inching up really daily. And so, and hopefully also because people are actually getting their first dose. And I have to tell you, people should not be shy. When our nurses go out and they give a first vaccine, we just jump up and down.
Yes.
There's no shame in this. It's not too late. And, we just want you to get vaccinated.
Right.
So 68.6% have had at least one dose, so that's some protection. In NASHUA, we have 58.8% fully vaccinated, and in Greater NASHUA, 58.5%. And those went up about 2% too over the last 2 weeks. So that is good news.
That is very encouraging.
So get fully vaccinated, protect yourself and those that you love and your community. And up to date, what does that mean? That means you've had your primary series and you've had your booster shot. So that's just really important to remind people that even though you've had your primary series, there is waning efficacy in the vaccine. So we just want to make sure people have that booster, and there's readily available now. No excuses. So we can take a breath. We can stop talking about COVID for like a minute, and let's talk about Public Health Week.
Yes.
So coming up in just under 2 weeks, we have National Public Health Week, and I looked. This is our 11th year in NASHUA celebrating Public Health Week. Very exciting. We have a lot of things planned, and what's exciting is that we can actually do them.
Yes.
So we have a walk with the mayor planned at our kickoff, and we have a health fair indoors at City Hall.
So with our partners. So we're going to be inviting our partners to join us, and we're inviting the community, So if you are available, the date is going to be on April 4th is when we start. And at 12 o'clock, we're going to have a proclamation by the mayor, and then we're going to kick that off with our traditional walk with the mayor.
And we're going to hope he's like the Pied Piper and just gathers everyone walking down Main Street. And so this year, our theme is Public Health is Where You Are, which is really a cool theme if you think about it, because, we weren't really, public health, we were kind of behind the scenes. I mean, for a long time. And with the COVID pandemic, oh, there I talked about it again. But public health was shot into the limelight. People are like, what are public health? Even for years when I tell people what I did or what my training was in, like, I don't even know what that is. So we remind people public health is where you are. It affects everybody.
It affects everybody and everything.
Right.
Right. And so when you do see us out in the front, it means that there's a problem.
Right. Yeah, we like to be behind.
Yes. So being behind the scenes and taking care of things and making sure that we're pushing out information to help people maintain their health and safety, monitoring diseases, doing investigations, and preventing the spread of diseases. I'm going to have to say it. COVID, of course, because of the novelness of that viral infection and how contagious it was, it just went like wildfire across the globe. And so you had to see us come out from behind the scenes to address the issue and put in those mitigative measures. But this is what we do all the time.
Right.
It was just COVID brought us from behind the wall. It's like the Wizard of Oz. We came from behind the curtain.
Yeah. So, you and I both taught Public Health 101. And so I kept thinking about how I would introduce that to nursing students, and so introducing it to the public. When you wake up in the morning and you brush your teeth and you use your plumbing, and that's public health.
Yeah.
That your water is safe and secure and adequately plumbed, that your septic system is working properly.
Yes.
Those are public health things. Then there's a million things.
There's a million.
But
that
you
lead
get-
has been removed from gas
Right.
tanks. That lead is not in paint anymore.
But you
that
get
you
into
have your
yeah.
seatbelt on.
Yeah, I was going to say, you get into your car, you have to put on your seatbelt, or maybe you take your bike to work, but you put on your helmet. Why did we have people do this? Well, public health used data, researched things, and realized that if people wore their seatbelts, they were more safe. So that was prevention, and that's what we're all about. So there's just a million examples that we could give, throughout the day. Even exit doors on buildings. You don't pull it in, you always push it out so you can get out of the door. These are all public health initiatives. These are all things for emergency preparedness, which is a big part of public health. So public health is where you are. It's a great theme. And I brought back the eggs.
You brought
back the eggs, and we'll put them up because we always talk about our partners, and you already mentioned our partners, but we have so many partners in public health, and especially living through these last few years, and I'm not going to say the word, but we have not only our health department, which is us in the center of this right now, but we have so many more. We have law enforcement, we have fire, we have our churches and our synagogues and our home health care. I don't want to leave anyone off, so please read read the image up there. But we have so many programs. We have laboratories. We have our doctors, our nurses, and our healthcare providers, of course, our elected officials. There's a lot of things we can't do in public health without the approval of our Board of Aldermen, for example, or without the support of our mayor. We have schools, of course, deeply involved with our school nurses and keeping schools open. And then all the programs that we had that we're getting back to now with public health, teaching kids about prevention and those kind of things. We have transit, parks and rec. So it is where you are.
Right.
So it's a great theme. We didn't think of it, but we're running with it.
We're always thinking of it.
Yeah.
We may not have put it out on the website, but we're always thinking that public health is where you are, and public health is in everything that we do. And like you said, through transportation, even how our parks and green space, that's all, based on promoting the health of the public, speed limits. There's so many things that are in place right now that impact the health and well-being and the safety of the public. The air, making sure that there's not so many emissions out in the air to impact, clean air and air filtration. And just there's so many things that there's not many things that you could think of where you wouldn't think of how it impacts the public's health and well-being. And that could be physical health, mental health, oral health, all components of it.
Yeah, years ago I was talking to someone from, I believe it was a charitable foundation. I said, I always turn, my issues into public health issues. And this person who was making, she goes, oh yeah, we can turn anything into public health issues. So, because it's all related back to the health of the community. So you already mentioned we have a kickoff on April 4th, and that's exciting. We're going to have that walk with Mayor Donchis, and it's a Keep It Moving challenge, so we want to keep people moving throughout the week. We have a walking challenge that people can sign up for, and kind of track your steps, challenge yourself to do a little bit more each day. I'm really looking forward to that, as is my dog, because my goal is to come home from work and take him out every day. Just wanted to share.
Yes. And I'm sure Rex will love that.
Yeah, he will love that. And I just think it's good though to have that like personal goal, make it a little bit more personal, because we can all kind of reflect on this, on like what can we do a little bit more. And for us too, to put our money where our mouth is. You know, it's so healthy to move more and to get out there. And the weather's getting better, so
I know. So, and you know what? And that's what's so good about the kickoff of Public Health Week. It falls right after spring, right? So spring sets in. And then it allows for us to kind of do that reset of thinking of like, what and how can I improve my health starting from right now? So Public Health Week allows for you to kind of like push out some ideas to folks. And there's themes. So every day there's a theme. And so it'll be all these things that we'll introduce our community to. And, you know, publish these themes on a regular basis. Hopefully we'll be able to push them out on the radio every day so folks will know what the theme is for that day, and just have people focus on those.
Right. So after we do our walk, we are going to invite the public to come up for our health fair on the 3rd floor, by the way. And everyone's like, oh, the 3rd floor. Yes. Yeah. And I thought, well, that's great, because then they can walk up the stairs. And that's good for you. And you get more steps in. And there's a lot of competition around our office around this walking challenge, so I will be walking up those stairs just to get those steps in.
I know, everything's about moving.
Yeah. So our first theme, I pulled these down today, is our first one is around racism, and really calling it out as a public health crisis. So I'm just going to read some of these bullets here so that we can kind of get our hands around it and people can understand. So racism shapes where and how people live, and what resources and opportunities they have. And racism directly affects the physical and mental health of people of color. So we really want to call that out during Public Health Week. And we're doing that in public health in several different ways, with our work to reach different communities of color, and different, I would say, racial and ethnic communities, and those that are kind of not getting the full services that they need.
Right. So when you think about racism as a public health issue, and remember, public health is about the population as a whole. And so there are things that have happened in our society that have impacted individuals that represent our Black and brown communities. But when you think about the impact of racism overall, it affects all of us, right? And so the health of a few impacts the health of everyone.
Absolutely.
In our country, what we need to do is acknowledge that it existed, right? And so there have been, unfortunately, disparities that have existed for long periods of time, long-standing, because of institutionalized racism, and we need to acknowledge that those things exist, address them, and come up with strategies to how we end that. Because you've got folks that won't go into the healthcare setting because of mistrust or lack of trust, misinformation, about services that they can receive. And then you also want to be able to just promote acceptance, so that we can get rid of these disparities that exist. But you got to first acknowledge that existed. So what's happened in our past, if we don't acknowledge it, these things can come back and they can occur again. And we actually do see some of these structures still in place. If I can't afford to live in a particular area, I don't want it to be because of my race. And so we do, unfortunately, still see some of those, or me not be able to access services because of my race. So let's acknowledge those things and let's move forward so that everyone, again, can live the healthiest life that they can without those barriers.
And how do we work toward that access? Because that's, you talked about trust and mistrust, but had a conversation this morning about people having to wait 4 months for an appointment. You need an appointment, you need to have that access. And, why aren't people getting those appointments?
So we're hoping that people will take the opportunity to learn about our country, its history. It's a part of it. It's real. And then what are some things, how can we work together to move past that? So a lot of the themes are going to really focus on what are the things that we can actually do to improve the health of our communities as a whole.
And there are actions that each of us can take. it doesn't just have to be a big collective or a
Right.
mass, a mass event. There are things that we can do in our daily lives, having that awareness, working for that awareness, and calling it out when you see it.
Right.
And bringing more awareness to other people that might be, oblivious.
Right. And we can all learn together.
Yeah. So our second day is about the public health workforce. And we know that that's essential to addressing the health challenges of our present and future. We talked a little bit about that.
That's where those eggs come in, Jane, right?
And a diverse workforce that reflects the diversity in a community can be better prepared to address these health disparities. And that's something I think we at the division have worked pretty hard to do, and will continue to work hard, is to have that diverse workforce so that we can meet the needs of our community, so we can make sure they have access to services and programs that are in the community and resources, so that we can bring everyone up.
Right. And it's about with that one picture, the slide that you showed with the eggs, that is the diversity that's in the workforce. And that goes across the different professions that are part of it, with our different disciplines, with our different generational, making sure that we have young and older individuals, because we all bring different ideas to the table, making sure that we are inclusive with the language, our knowledge, gender, right? So there's a lot, look at different professions, you'll see that there's certain genders that are the majority, and so you want to make sure that you're equalizing all of those things and having equity across all of those different professions in those fields, so that we can provide the services that we need across the population group based on those that we're serving, right?
Absolutely.
So we got to bring our workforce up with this skill set and competencies, knowledge and training. So that's going to be a good focus as well. We're working on all of these things.
It's always working on that. And then next is community, collaboration, and resilience. I like to call this our social determinants of health slide. It includes every aspect of our lives. So health is 20% of our health is the actual health care that we get.
Right.
But as you like to say, where
80%?
we live, eat, work,
Yes.
pray, housing, education, food, transportation, and the environment,
Right.
those play a huge role in our overall health. So you have to be made aware of that. And in our division in public health, we do have a welfare department. They focus a lot on housing and housing insecurity and helping with utilities and those kind of things. So, which is, really important in public health, because if you don't have a home to go to at the end of the day, it's very hard to stay healthy.
Yeah. If those basic needs aren't met, it's really hard to think about prevention as well, right? And so we want to make sure that people feel safe, that they have a place to go, a roof over their heads, they can earn an income. These are all the parts of those things that we call the social factors that impact our health. So where we live, work, and pray. Got to make sure that we focus on those.
And don't forget to eat.
It's I know food is so important.
I always have to throw that in. And then World Health Day, health is a human right. And to ensure good health is a reality for everyone, all countries must make sure that health is a right for all people. So we'll do our part in our microcosm here, but it is a global issue.
It is.
Improvements in funding, services, and access to care are critical to improve health and to reduce the spread of disease.
Yeah.
So I think of this a lot, especially as we're working still in a pandemic, and you think about the vaccination rate overseas, and a lot of people are itching to get back out overseas and to go places. And I think until we equalize, that distribution of vaccine and really help control the pandemic everywhere.
Right.
I mean, because really the world is much smaller.
Yeah.
The virus may start in one place, but it's going to travel. So.
And we're global. If we even think about things that are happening with our climate, if we think about access for just regular medications and other vaccinations, if we think about child mortality or infant mortality across the globe, these are all of these things that impact everyone's health, right? And so when we think of like the global health, it impacts us here. Yes, even all the way over in New Hampshire, even air quality can impact us over here, right? And so we do have to think about our footprint, our carbon footprint. We have to think about the resources that we have here and how they impact all of us here, and then what resources other folks don't have, how that impacts there, and then how we're all connected.
Only as strong as our weakest person, our weakest individual or country even. So next is closing the equity gap. So this is, we can work together to improve the health of people living with disabilities and other marginalized groups by increasing availability of the appropriate care, building inclusive public health programs, and promoting healthy living. So this, again, this really addresses our populations that are living with disabilities and coping with it every day, and how are we aware of it and making sure things are accessible to this group.
Right, and equity means that everyone has the same opportunity. And so I might need more than you, Jane, or you might need more than I do. And when we think about making equitable opportunity for everyone, then we have the resources to make sure that those that need more get more, so that everybody is in a place of living their best lives.
Right, and that's an important distinction to make, because some people say equality. Equality is not equity.
Right.
So if and then there's a great image of, you know, people looking over a fence, and you've got the short guy, or you've got the little kid and the father, and then the older child, and they're all on boxes. And, you know, if we all give them the same equal box, the little baby's still not going to be able to see. But if he gets a big box, he's going to be able to enjoy the ball game just like everybody else.
Right.
So I think that's an important distinction, that sometimes people need more.
Right.
And they're entitled to it.
Right, and we have the resources to make that happen. It's just, again, it's about acknowledging that these things exist, and then paying attention to those things, and then working together to ensure that we create opportunity for everyone. So that's that assurance part of public health in our core.
The big A. So, and then we talked a little bit about this briefly, because we're running against our deadlines here, but climate change, taking action again for equity. Climate change is one of the most significant public health threats today, and solutions to climate change must address how certain populations experience a disproportionate burden of climate change effects. So that's, where are those factories built, and where is that housing built, and is it next to it? And how is that water? Is the water contaminated, you know, from a factory emission, and those kind of things?
And what are we doing individually to impact what's happening with the climate?
Right.
Our garbage, our consumption, how we're disposing of things. All of those things are important.
Right, the recycling, composting. I'm a big composter. And then finally, we have one last thing, and then we'll wrap up, but we have mental wellness and redefining the meaning of health. And this we've seen across the board throughout the pandemic, post-pandemic. We've seen the repercussions of isolation and just people being, you know, thrown out of their normal routines, and the depression and the sadness, and that has come over a large set of our population. So it's a critical component of public health. We've always talked about mental health in our division, pre-COVID, now during COVID, and now as we're coming out of it. But we saw, even as we worked on our community health improvement plan, that our primary care doctors are now considering that one of the most pressing issues among their patients.
Yeah.
So early detection and treatment of mental health, very important, and it can improve the health of our community. So the head, the mouth, we're all part of it's all part of health.
The whole person.
Yeah, mind and body. So that's all I have. It's going to be a great week.
It's going to be a great week, and we're again inviting folks to join us for that kickoff, and then stay tuned for every day as we talk about the focus for each day, and then think about what are the things that you can do as an individual that then aligns with what we do collectively to improve the health of our communities.
Absolutely. I want to remind people that you can visit our health clinic, which is Tuesdays, Wednesdays, Thursdays, and Fridays, and you can call for an appointment ahead of time. We do offer immunizations, childhood and adult. We have STD, HIV, HCV testing, and we have lead testing as well. So please give us a call at 589-4500, option 2. And thank you all for joining us for Public Health Matters, and have a great and safe week.